Welcome, and thank you for standing by. At this time, all participants will be on a listen-only mode until the question-and-answer session of today's call. At that time, you can press star 1 to ask a question from the phone lines. I'd also like to inform the parties that today's call is being recorded. If you have any objections, you may disconnect at this time. I'd now like to turn the call over to Ms. Karen Francis. Thank you.
Okay, thanks again, and good afternoon, everyone, and welcome to the first webinar for the 2015 Rural Behavioral Health webinar series. My name is Dr. Karen Francis, and I'm a principal researcher at the American Institutes for Research and lead for the Rural Behavioral Health Initiative, along with my colleague Joyce Sabian from the Mental Health Promotion Branch of the Substance Abuse and Mental Health Services Administration. Now, this webinar series is supported by the Mental Health Promotion Branch of SAMHSA in collaboration with the American Institutes for Research and Affirma Solutions. So thank you for joining us this afternoon. We are looking forward to a lively and engaging conversation about early childhood development in rural communities. I am joined by Ekaterina Zubak, Public Health Advisor, the Mental Health Promotion Branch of SAMHSA, who will provide an overview of the SAMHSA-funded Project Launch Initiative and the work currently being conducted in rural communities focused on early child development. And I will also be joined by Dr. Dawn Graham from Ohio's University Heritage College of Osteopathic Medicine, Department of Social Medicine, and Assistant Professional Social Medicine. And Dr. Graham also serves as the Project Director for the Project Launch in Southern Ohio. So today's webinar will present strategies focused on promotion of healthy child development and prevention of developmental challenges. So today we will hear from Ekaterina Zubak, who will provide, again, as I said, information about the Project Launch Initiative framework funded through SAMHSA and its implementation in rural communities. And then I will engage in a facilitated dialogue session with Dr. Graham to discuss the work of Project Launch in Southern Ohio and provide lessons learned of this innovative rural team that can help others develop and enhance their early childhood initiatives and promote early childhood mental health and well-being. So before I turn this webinar over to Ekaterina, we have 2 polling questions that we'd like for you to respond to. And so the first polling question is to give us a chance to see where you're from or where you represent in the community across the country. Could you just take a few minutes to tell us where in the region is your community located? And so I'll just give up another half a minute here for So I want to give a shout out to the Midwest because we have the majority, the Midwest and the Northeast Mid-Atlantic, where the majority of our participants in the webinar this afternoon hail from. So welcome again to you all. And then the second polling question is that what is your role in your program or your community? And so that's to give us a sense of who, we have on our call on the webinar this afternoon. I'll just take another half a minute here. So we have about 42% of our participants this afternoon, say that their role is other in their system of care. So, beyond the pieces around early childhood practitioners or clinicians of those categories. So if we could just move on to, I think these polling questions here, we've moved on. So at this point, I want to shift gears a little bit and want to turn the presentation over now to Ekaterina, who will provide for us an overview of the SAMHSA Project Launch Initiative. So Ekaterina?
Great. Thank you so much, Dr. Francis. I was having a problem with my slides, but I'm back now. So I'm very excited to be part of this webinar, and I'm really excited to be talking about Project Launch. So what I'm going to do is give a brief overview of SAMHSA's Project Launch grant program, and then describe some of the specific work that our grantees have done in rural communities, both within states and tribal nations. Some of you might already be involved or know about Project Launch, so I'm going to be as brief as I possibly can, and of course I'm available for follow-up questions via email if you have any. So what is Project Launch and what is its goal? We are a grant program that's funded by the Substance Abuse and Mental Health Services Administration since 2008, and we focus solely on children birth to age 8 and their families. So far, we have funded about 6 cohorts of grantees since the beginning of the program, with a total of 55 grant sites nationally. The implementation of Launch has taken place in numerous states, communities, tribal nations, and territories, both rural and urban. Most of the families we serve live in high-risk, impoverished communities. One of the main core tenets of Launch is that its approach is grounded on the knowledge that early experiences are determinants of later health and behavioral health outcomes. So the overarching goal of this program is simple and aims to promote the wellness of young children by addressing all aspects of their development: physical, cognitive, behavioral, and especially social and emotional. Launch aims at providing an opportunity for communities to support the youngest and most vulnerable residents and their families, as well as the complex systems and structures that are already in place to meet their needs. It's important to note that we use a public health approach and aim to reach and support all young children and families in the community that the grant is implemented. You might have noticed that I am referencing families of young children a lot, and that's because one core driving principle of Launch is the recognition that children live within families and communities, and the way to successfully foster healthy development is to support the parents, the caregivers, and the communities and the systems and the settings where young kids live, play, and learn. So in fact, as I will explain a little bit later, Launch not only supports the dissemination of promotion and prevention services and evidence-based programs, but also seeks to improve coordination across child-serving systems and build infrastructure at the state and local levels, tribal and territorial levels as well. So I'll talk briefly about the structure of our grant program. So state and tribal grantees are funded to work with a pilot community for 5 years, pursuing dual goals of improving systems and services. Depending on the location of the site, the pilot community may be several zip codes in a county, an entire tribal reservation, or even an entire county in some rural sites with low-density populations. We have also awarded recently funding to 3 territories who have opted to use several islands, for example, as their pilot community. So the way Launch looks can really vary from location to location and really depends on the type of community where Launch is being implemented. So this slide right here summarizes the core concepts that drive the work of Project Launch. In a nutshell, the local service goals include improving access to evidence-based prevention and wellness promotion practices, and really infusing mental health-informed practices into primary care, early care and education, home visiting, or family settings. Basically, all the places where young children can be found. Really, I want to highlight that the common denominator for most of the activities at the local level is the focus on social-emotional development of young children and the importance of mental and behavioral health. Launch works to support the building of expertise and capacity around mental health and related topics in these various settings that I mentioned earlier. I also want to emphasize that we are not a treatment program and do not fund treatment services, but we do support the grantees' work around improved linkages to treatment and better care coordination. Finally, Launch enhances systems and expands the capacity of states, tribes, territories, and communities to serve the most vulnerable populations. We're not reinventing the wheel, but we are building on what's already there. The local and state or local and tribal partnerships that result from Launch help to address barriers to success and enable sustainability and scalability of innovations and policy changes that may be a result of the grant's work. So the key messages I want to leave you with are that Launch focuses on children birth to 8 within a promotion and prevention scope, using a public health approach, and strives to both disseminate promotion and prevention services and improve key systems of early childhood. And here is a better illustration of the two-pronged approach that is part of Launch So on one hand, you have local level support of children and families, implementation of evidence-based programs and practices, and then on the other hand, you have local level, state level, tribal level work that's focusing on the systems and kind of focusing on infrastructure building and improving the collaboration and coordination of services. So what do we mean by promotion and prevention services and practices that are at the heart of launch? Here are 5 areas, also known as 5 core strategies that launch grantees are required to address. As you can see, some of these areas may already have a precedent in a state or tribal community, and some of these efforts may already be funded, like home visiting, for example. This again speaks to what I mentioned earlier, that some of the work funded by launch really expands, enhances, or fine-tunes existing supports and early childhood efforts by improving collaboration or improving capacity around mental health and social-emotional development. So I'm going to go over some of the 5 core strategies of launch briefly, just to give you a good picture of what some of the activities that our grantees are implementing at the local level. So first you have screening and assessment in a range of child-serving settings. I want to emphasize the word range here. The goal of the strategy is to increase the use of validated screening instruments with a particular emphasis on social and emotional functioning to ensure that developmental and behavioral issues or concerns are identified and addressed early. So some examples of activities might include working with a variety of providers to implement screening and assessment in a different setting, like primary care, child care, home visiting, or provide mental health consultation with providers to share strategies for talking with parents about screening results, for example, working with home visitors or primary care staff, providing mental health consultation with providers in child care on how to incorporate screening results into classroom strategies and approaches. And also a lot of it focuses on public education and awareness-raising activities to help parents be better informed about developmental milestones, and especially social and emotional developmental milestones, and really increase the understanding of the process and importance of screening. Then we have the integration of behavioral health into primary care setting strategy. The goal of the strategy is to increase and improve identification of behavioral issues in young children, and also to appropriately address these within the primary care setting. Some of the activities of our grantees focus on increasing knowledge, building capacity again, and changing practice in primary care, and also co-locating, in the best case scenario, mental health and family support professionals within the primary care setting. Other examples could include embedding of mental health consultation into primary care for case consultation, or the embedding of family partners or family advocates in primary care settings to function as part of a team that supports the family. Some of our grantees have also focused on working with primary care settings to improve screening protocols, referral processes, and linkages between primary care and other settings, like early care and education and home visiting. And then we have mental health consultation in early care and education. The goal of this strategy is to ensure that early care and education settings provide optimal learning environments for young children that lead to positive development across all domains, with, of course, a particular focus on social and emotional development. The consultation that's being provided builds capacity of early care and education providers to better address the behavioral and social emotional needs of children and provide support when there are specific challenges. It can look like programmatic consultation at the center, school, or classroom level to support strategies that promote healthy social and emotional development for all children, or it can look like targeted mental health consultation to address the needs of a particular child or family with behavioral health concerns. Consultants can also provide training for providers and teachers on topics related to children's social and emotional development and behavioral health issues. Finally, we have the enhanced, again, key term, enhanced home visiting through increased focus on social and emotional well-being. We try not to fund home visiting services as they're already being funded through other means. And the goal of the strategy is to really expand and, again, enhance existing home visiting programs with particular attention to increasing the focus on promoting healthy social and emotional development among the children and families who are receiving these services. So, again, mental health consultation can be embedded here. Additional training opportunities are offered to home visitors around topics specific to early childhood, behavioral health, trauma-informed care, and so forth. In a lot of cases, launch grantees have expanded the capacity of existing home visiting programs when there is little opportunity to provide home visiting services by adding additional home visitors, bilingual home visitors, or extended supervision. And in other cases, grantees have improved the coordination across existing home visiting programs to reduce duplication or improve processes for matching families with most appropriate placement. And finally, last but not least, we have the Family Strengthening Parent Skill Training Strategy. Really, the goal is to help improve the outcomes for young children by helping their parents or caregivers to provide healthy, safe, and secure family environments. Some examples of the activities include offering parenting groups or caregiver support groups that provide support and education related to parenting, training for community providers in evidence-based family strengthening programs and practices, offering parent cafes or community cafes, and providing parent leadership opportunities and supports. And of course, these activities are not limited to parents only, but also caregivers in the extended family unit. So as you can see, we have a variety of areas that grantees have to address as part of their project launch efforts. Here's another slide that's really important that kind of highlights the gist of the work that we do. Because we are a promotion and prevention program, it is important to understand the continuum on which some of these services may fall. While the underlying idea is to provide supports to children, families, providers, and communities to prevent later life challenges and build resilience, in many instances there may be a need for more targeted supports for families with more needs. This graphic helps better understand how the diverse and varying needs of the families can better be addressed through project launch. And as far as systems change goes, the key elements of the infrastructure aspects of project launch include the formation of young child wellness councils, both at the state and tribal level and also locally. There is also a very thorough environmental scanning process that takes place in the beginning months of the grant that brings together a variety of stakeholders, partners, including family members, and helps to chart the landscape of early childhood in the given pilot community, and really prepares the recipient of the grant for a very thorough strategic planning process. Infrastructure at the state level builds upon the Early Childhood Comprehensive Systems, ECCS work, funded by HRSA, as well as being integrated with other early childhood-focused efforts like McV and Race to the Top Early Learning Challenge grants. So that's launch in a nutshell, just to give you a brief overview of who we are and what we do. As you can see, we are spread all over the nation. We, like I said, we have awarded 6 cohorts, and here's a list of all of our grantees up to date, state, tribal, and territories as well. Here is a map representation of the same information. You can see we have a pretty wide reach. And so recently our portfolios, so to speak, of rural communities who have received Project Launch Award have really grown. And so here's an example of some of the communities that we have worked with. You know, from Montana to Louisiana to Georgia to West Virginia and Indiana, we are working with a lot of rural and pretty remote areas. I have to note that most of these grantees are pretty new and have just joined the launch group. So some of their efforts are still in the planning phases. They're still conducting the environmental scan and engaging in strategic planning. So we have yet to see some of the specific strategies they're going to implement to address the needs of their populations. We also have several sites who are located in tribal communities that also work with rural populations. You can see some of the different tribes we have worked with and are working with right now, ranging from locations in New Mexico to Kansas to Montana to Maine and Michigan. And here are some examples of how some grantees in the past have addressed the specific needs of rural populations. So, for example, in Indiana, they have partnered very closely with the Department of Transportation to address access to services. And the Department of Transportation has sat on the local and state Young Child Wellness Councils to be part of the conversation and the strategic planning in which the grantee has engaged to make sure that we're there at the table and be part of those discussions. Because what has been found was that the families were really having a hard time accessing services due to being located in their remote areas. And then in Washington, in Yakima County, they found means to provide on-location training and services and actually bring the services to the community within the rural setting and even schedule regular events like rural health fairs. And then you have Washington County in Maine, which implemented a very successful and very beneficial bridging program for women who are at risk of substance abuse issues and had high-risk pregnancies. And so what the grantee has found that in a lot of the cases, these women would travel very far to deliver their babies because of their high-risk pregnancies, because of risk factors and substance abuse issues, and then would be disconnected from their original location and family, and they would have to come back with a high-need baby, for example, after a long stay in the NICU, and be disconnected from some of the intensive services that were provided in a remote hospital setting. So what Project Launch has done is put in place a system, a bridging system, to connect these families and these women to home visiting services, to other sort of supports and providers that would work for them and the hospital and the NICU staff to kind of create a system of support that would that has resulted in better delivery of care and smaller rates of rehospitalization for the babies. And also in Maine, they wrote a lot of briefs on transportation issues and how remote locality has been associated with higher cost of services, and have really worked closely with that county and educated state legislators on those issues. So that is Launch for You in a nutshell. We are very excited to be working with such a diverse group of communities and hope that we can address the challenges faced by rural communities and also learn about the strengths of the rural populations in our work in the future. Thank you very much. Karen, back to you.
All right. Well, thank you so much, Ekaterina. Thanks for the overview. And so I just wanted just to open the lines up now for some Q&A. Are there any questions that anyone has for Ekaterina at this point? Please unmute your lines by pressing, is it *6? That will unmute you. Go ahead, I'm sorry.
I apologize. You can press *1 to ask a question from the phone lines. You will be prompted to unmute your phone and record your name. Again, that's *1.
Thank you. So any questions for Ekaterina?
I'm currently showing no questions in queue.
Okay. All right. So at this point, you know, I want us to just shift gears a little bit, and we have another set of polling questions for you before we move into the discussion session with Dr. Graham. So first polling question here, polling question number 3, is does your community have a focus on early child development? Yes or no? Okay, so at least 66% of you on our call this afternoon, you know, have a focus and do work around early child development. And then the second, fourth question, polling question, we could bring that up. What strategies are most interest to you? What do you want to learn about on this webinar this afternoon? You know, responses to this, we will try to fashion some of the questions and this informal discussion that I'll have with Dr. Graham to ensure that we are addressing some of the issues that you do provide us with information about here. So I see here that engaging families and young children, you know, is an important piece that many of you would like to hear about today. And there's some interest on the piece around return on investment and, you know, developing state and community partnerships. So I feel confident that we'll be able to address those needs and provide you with some of this information this afternoon. All right, so at this point, I'm anxious when I get this conversation started here. So I'm going to shift gears here a little and talk with Dr. Graham about her work and the work of her colleagues with their Project Launch program initiative that serves children ages birth to 8 in a rural and economically impoverished region of southern Ohio. Dr. Graham, it's a pleasure to have you join us today. to share insights and stories to inform our webinar participants as they themselves consider how to build on the strengths in rural communities and families who face formidable challenges in addressing the health and behavioral health needs of children and youth. So let me begin by asking you first, tell us a little bit about your community in Southern Ohio and about some of the unique challenges you have met with in the rural setting.
Sure. So good afternoon, Dr. Francis, and thank you all. Hello, audience. Again, my name is Dawn Graham, and I'm representing Ohio University. And I'd be happy to tell you about that, Dr. Francis. So I'll describe a little bit about southeastern Ohio. In the project launch grant that ran from 2009 to 2014, I had the honor and the privilege to work with a very dedicated and lovely group of folks called IPAC, or Integrating Professionals for Appalachian Children. We were part of the cohort 2 of Project Launch that Ekaterina was telling us about that began in 2009, and then we just completed the project launch at the end of December 31st, 2014. So just to kind of give you a little bit of where we are in the entire process of launch. To give you an idea of southeastern Ohio's project launch, we represent 4 counties in southeastern Ohio. So we are approximately 90 miles southeast of Columbus, Ohio, and approximately 30 miles northwest of Parkersburg, West Virginia. We're in the beautiful part of Ohio in the foothills of the Appalachian Mountains, and the 4 counties that we represented through launch were Athens, Hocking, Meigs, and Vinton counties. And just to give you an idea, those are 4 very rural counties that represented approximately 1,775 square miles, which, if I did my math right, that represents approximately the size of Rhode Island. So southeastern Ohio has a little bit of urban area in the fact that Athens, Ohio is home to Ohio University. So we have a 22,000 student campus here at the public university. But the remaining areas around this region are very rural, as some of our listeners are probably can attest to, in very rural areas of the United States. So, some of the difficulties that we face are extreme poverty in some of our areas. As the coal mines have shut down in this area, it left many of our community members out of work. We have intergenerational poverty that we're dealing with. We have very specific high rates of smoking among pregnant mothers and children, or pregnant mothers carrying children. And then we also have some issues with transportation. So if you blend all of those challenges together, folks who are out of work or have sporadic work, combined with transportation issues, we're 45 minutes from the nearest Target where I live right now in Athens. So just to give an idea of, as many of you also probably face, in the rural communities, not only do you have intergenerational poverty, but you do have transportation issues, intergenerational challenges with finding work, sporadic work, and really ready access for health care, particularly for our young children and families. Our specialty hospitals, the nearest one is Nationwide Children's Hospital in Columbus, which is 90 miles northwest. We also have Cincinnati Children's Hospital. Cincinnati is about 2.5 hours by car west of here. So specialty and ready access to care for our children continue to be quite the challenge.
So thank you so much for painting that picture for us, Dr. Graham. So you talked about the issue of the poverty, the high rates of pregnant mothers, smoking, so those issues around health and health care, some of the transportation limitations, the issues around unemployment, and the issues around the availability or access to health care services. So, well, given all of that, how would you say, how did your community go about building an overall system of care in your rural region to be able to address some of these issues that you spoke about earlier?
Sure. So thank you, Dr. Francis. I really have the privilege and the honor to be working with groups of people who started this process long before I came on board. So I'm originally not from this area. I'm originally from the Chicagoland area and moved down here in 2009. At that time, there was already established and continues to grow a regional collaboration of healthcare professionals called IPAC, or Integrating Professionals for Appalachian Children. Project Launch had already been written by my colleagues, Dr. Shamblin, Dr. Hamill-Lambert, and Dr. Groves up in Columbus for Help Me Grow Home Visiting. And so the regional approach had already been established by the time I got there. So I really had that luxury of coming into a system that had already been established. What Launch was able to do was to continue to expand those efforts and specifically focus on some of the gaps in services that we were unable to get to, either financially or because of human capital. Launch was able to expand those efforts. So one of the things that we really focused on when starting Launch in the community was getting the group of people that was already around the IPAC table together and expanding into the surrounding communities. So IPAC started in Athens County basically because that's where most of the people were. Because Launch was written for the surrounding counties of Hocking, Meigs, and Vinton, one of the first things I did as project manager was to start to reach out to some of those other surrounding rural counties. Now, as many of you who are listening probably already know this is not an easy task. First of all, I'm not from here, and second of all, a lot of these things, relationships develop over time. So I was basically gaining champions around the established IPAC table and said, look, I need to grab people from outlying counties of Meigs County and Hocking County. I need to get into these meetings so that folks start to learn who I am. They start to, recognize my face around the table, and we start to develop relationships. And as many of you can attest to, that takes a lot of time and actually over many, many years. And so that was one of the first things that we did in terms of building an overall system of care. The second thing we ended up doing was working with IPAC in developing a local communications team. So what we did with our local communications team was we hired someone from the communications school here at Ohio University, and a photographer and a health communications professor, and we started a media campaign. So it was really very exciting because the media campaign focused on taking pictures of our kids in this region. So we developed a developmental screening booklet where we gave those out to the local schools, the local libraries, the local parenting groups, and said, this is what's available in your community to provide access to health care. One of the things that we learned that was very interesting in terms of our communication in reaching out to our local communities was that we originally came to the first table, and again, my colleagues, Dr. Hamill-Lambert, Dr. Bates, Dr. Shamblin, they started this process prior to me, and I was just able to take the ball and run with it. But what we did was our regional strategic communications plan was, our hypothesis was that our parents and families didn't know where to send their kids to access health care. So we had the luxury of having some grad students, and we went out to our local Family Dollars and Dollar Generals, and we did parent surveys. And what our parents told us, Dr. Francis, was actually we were dead wrong. What our parents told us was that they knew where to go to access health care, but what the thing was is they didn't think it could happen to their children. They didn't think it could happen to them. Which was fascinating to us, which is the importance of pilot projects is don't go on what you think is right. You have to ask your community. Unfortunately, we learned that one the hard way because we had to go back to the drawing board, and we said, oh, my gosh, we were dead wrong. So what we ended up doing was taking that information that the parents and families gave us and really developing a communication strategies around specifically educating parents, and those of us who are parents know that it doesn't come with a handbook, right? They don't tell us this. But really what typical developmental milestones were. So we developed a series of two series of posters. The first one is basic health and wellness for young children. So basic dental health, what does that mean? The basic signs of autism, what does that mean? The importance of play and exercise in outside and developing places for your children to play, especially in rural communities where city parks aren't the norm. And then the second series of posters is we actually took from our launch colleagues in New Mexico. This was not our idea. We stole it from our colleagues. So for those of you launch people out in the audience, I highly, highly recommend take the ideas of your colleagues and run with them. They are there to help you. You are not alone. We got some ideas from our colleagues in New Mexico about developing a poster series that was aimed at specific developmental milestones. So from the ages of 6 to 12 months, this is what you should expect from your child. And we plastered them everywhere in southeastern Ohio. We plastered them in libraries and schools. I handed them out at the local council meetings, the state council meetings. I drove around. In fact, I'm sure I still do have a couple floating around in my trunk. We were literally on the road. Our goal was to educate our parents about what to expect. And so those, long answer to your short question, Dr. Francis, I apologize, but that was one of the first things that we did to start to spread out into our community to realize that as a system of care, that was not just professionals, but those were our families and children as well.
Okay. No, well, thank you for that, because it sounds like the IPAC was the nucleus and the driver for your collaboration and your partnerships, right? And you also seem to have had some real, lessons learned about family engagement and the whole piece around access to services or their perception around access to services. So if you could just explain some of the challenges that you had in terms of communicating the needs, up to the state and even to the federal level from your local perspective.
Sure. So that's a really interesting question because I think that could be a webinar in and of itself.
Right.
It's not rocket science, Karen. I think, just the answer to everything is communication and relationships.
Right.
Our main challenges, it's particularly, and I have to say, I own the challenge of, I'm a counselor by training. I'm a psychologist by training. And I had no idea what I was getting into in terms of policy development. I had some wonderful colleagues at the Ohio Department of Health in Columbus that really helped me to learn how to navigate the system of policy change and really learn the language of policy development. And my colleagues at SAMHSA, Jen Oppenheim and Andrea Harris, Ekaterina, they all just were so patient with me and held my hand to help me navigate what the process looks like at the federal and state level. So, I put a lot of mileage on my car. I was up in Columbus, 90 miles north of here, several times a month, and as were my colleagues down from Columbus down here, to learn how to navigate each other's systems. So the language that we used from the locals was that we said we would bubble up our issues. So I would gather the information from my amazing team down here and all of the information, lots and lots of meetings, lots and lots of individual meetings saying, what are we doing? What can we still do to meet the needs of our kids? And then we would go up. I would bring people in my car to Columbus to sit around at the State Wellness Council and say, these are fantastic policies on paper, but in reality, maybe we could do it this way better. And over time, at first it was very, very difficult because, there's a protocol and there's an etiquette, of course, involved. But what happened was that over time, we developed these relationships with the state partners and the local partners where it wasn't just me as the face of launch. It wasn't just Jane as the face of IPAC or the executive director as the face of IPAC, but there was a network of people that started with a network of people up in Columbus. And those relationships, I'm very proud to say that they're still going to this day, and they continue to bring not only human capital, but resources and leads to other grants. It just kind of spider webs from there. But I would say again, long answer to your short question, one of the challenges was just continuing to have those conversations, learn the language, break down those barriers, and have that face-to-face time, because once those relationships are established, we were able to make things move a lot more efficiently and more quickly for our children down here.
All right. So as you mentioned, Dawn, about, learning how to navigate the system, the issues and, the real building up relationships. So if you had to think about it, did you face any other challenges, that you think you successfully overcame, or, that you're still working on to get to the other side of?
Sure. So, there's a couple of examples that come to mind in terms of specific challenges. One in particular was, as Ekaterina mentioned, was one of the strategic initiatives of Launch was home visiting. So when Launch was written before me coming on board, it didn't make sense to recreate a system of care when the state of Ohio already has a fantastic Help Me Grow system through the Bureau of Maternal and Child Health. Fantastic system already in place. How can we contribute to that? Well, an example of one of these challenges is the Policy Act, April 11th, 2011. I'll remember this day very clearly. I was up in Columbus with our state colleagues, and the conversation came around changes in policy and reimbursement structures for our Help Me Grow home visiting system. Okay, so essentially what happened was that there were changes at the policy level and the reimbursement structure that did not allow us at the local level to fund personnel in the way that we had been funding, nor could we count individuals served in the way that we had been counting. So, my state colleagues at the policy level were like, well, what's the big deal? We just changed the policy. And I said, well, the big deal is that we can no longer employ these individuals. And the choices of employment are not like they were in Columbus, and they're not like they are in Chicago. It is difficult to find a job down here. And so I need to talk about what is a way we can overcome these challenges, because I'm not going to go down to Meigs County and tell one of our home visitors that she's out of a job because somebody changed a policy up in Columbus. And so there started a series of very challenging, to be honest, conversations about how policy really does affect practice down here. And without having those pre-established relationships, those conversations could have shut down pretty quickly. But because of the established relationships, because we had been talking about these things, we can say, well, you know what, at the local level, this doesn't work. So we said, okay, so we can't change policy. But then I started having conversations with our local Help Me Grow home visitors, and they said, okay, well, what else can we do with this funding stream? So Launch provided a lot of funding. Okay, if we can't fund personnel, what can we do? And actually, over the course of about a year and a half, my colleagues are amazingly creative, and they said, okay, well, let's go into workforce development. Let's get Growing Great Kids or the Parents as Teachers curriculum. Let's blend funding streams across county lines in southeastern Ohio. Let's put our money together. Let's train a whole group of individuals rather than sending everyone to Columbus or everyone to Cincinnati. Let's blend those funding streams and really get great big impact to train trainers down in this region. And so creatively, we talked with our state Help Me Grow home visiting folks and said, okay, so given the new policy changes, how can Launch help? How can we help with this program? You still get your needs met. We still get our needs met. Everybody's happy. So I'm very happy to say that's an example of a very successful challenge that we were able to overcome. Some of the policy changes in terms of billing codes, we're still working on. I have colleagues across the state that are working on the integration CPT billing codes, which I can talk about more later if anyone's interested. But that's the prime example that comes to mind.
So we know that a lot of times some of the barriers that are presented to us around for delivery of services, that piece around financing, right? And how do these services get paid for? So could you talk a little bit about your organization and your efforts towards blending funding streams and continuing the services provided after even the Project Launch grant was over? What were some of the your tenets around sustainability of the programs and services?
Sure. So that's a good question that a lot of our Launch colleagues have over time. I'll start with one of the lessons learned. One thing I wish I had done differently, or as I tell my launch colleagues, a pile I stepped in that I don't want anybody else to step in, is to plan sustainability from day one.
Right.
You are going into the launch grant knowing that it's a finite amount of time. It is never too late to start thinking and planning in terms of sustainability. We had a fantastic evaluation team that really helped me think strategically about how do we keep these things going. The Ohio Department of Mental Health and Addiction Services was able to write and procure the Race to the Top grant, which helps facilitate some of our early childhood mental health consultation programs to keep those up and running. And again, because of those relationships that were developed around the state wellness council team between the state and the local councils, those relationships were established so that some of our leadership at the Department of Mental Health was able to call up some of our folks in community mental health down here and say, hey, look, if we got this Race to the Top grant, what would you do with this money? And some of our colleagues down here would say, well, I know exactly what we would do with this money. So it provided Race to the Top grant funding. The state ended up getting the McVie home visiting grant. Most importantly, for sustainability purposes at the local level, what happened was Launch was able to, press the fast forward button on a lot of the projects that were already going on. So, for the school outreach program doing developmental screenings and assessments, we got a lot of buy-in from the local school systems because they realized that when we funded a school outreach worker to be in that school that had 80% poverty level, that she really made a difference. And so subsequently, we had buy-in from the schools because they realized how important it was to have that school outreach worker doing some of the work that the guidance counselors simply didn't have the time to do. Our local children's services agency changed their strategic initiative and said, look, this is really important that we have outreach workers in our community schools. And because of Launch and the resources of Launch, we had the data to give to them. So my colleagues at the Voinovich School, Dr. Leslie Johnson and Amy Collins, and I literally went on a road trip and went to our collaborating agencies, and there was over 80 of them by the time Launch was over. We didn't go to all 80, but we went to many organizations, and we said, look, this is what the data shows. The data shows that this is making a difference. This is why you need buy-in. And that honestly gave us the most leverage. Now, I'm also proud to say that my colleagues that lead IPAC also was able to write for a subsequent HRSA grant for trauma-informed care, and funding streams just continued to blend in. But again, going back to my initial point, it's never too early to plan for sustainability because it's those relationships that lead to further both funding, capital, as well as human capital.
Right. No, that's sound advice. Sustainability should begin day one, right, of this grant. So, yeah. So I just want to open up the phone line to see if there's any of our participants that have a question for you, Dr. Graham, before, we go on with some of the other questions that I have. So any questions for Dr. Graham at this point? You've pressed *1 to unmute your phone.
And we do have a question from the phone line. Participant, your line is open.
Okay, go ahead. Pressing *1 to unmute your phone, please.
Participant, your line is open. Can you please check the mute function on your phone?
Again, *1 will unmute your phone. Okay, it seems that our participant has some problems, some difficulties with unmuting. So do we have any other in the queue for questions?
I'm currently showing no questions in queue.
Okay. Alrighty. So Dr. Graham, it appears that, despite the limited resources, your community has been able to sustain the programs and services beyond your federal grant, right? So let us talk about that particular piece for a few minutes. So what would you say are some of the unexpected results you've experienced as a result of collaborating with early child-serving organizations?
Sure. So some of the unexpected results, I found myself in places talking to folks in leadership at the state and federal levels that I could have never anticipated. I had a conversation with the governor in the great state of Ohio about keeping rural Appalachia on the radar, and was able to speak about those things with him. One of the unexpected results, and it shouldn't have been too unexpected, but one of the things that I found just amazing was that through relationships and over time that, there are funding streams that happen that I never could have anticipated. There were coordinated systems of workforce development that I could have never anticipated across county lines. So organizations that historically have been siloed from one another were able to join forces and join funding for everyone's benefit. An unexpected result was that when in the smack dab middle of cohort 2 of Project Launch, we had a complete change in state government and had a complete change in our state council. Because of the relationships and building collaborations with our state agencies, we were able to continue and even strengthen the state council after that change in leadership. And that was a very challenging time, but completely unanticipated that, one of the fantastic things about early childhood serving systems is that everybody gets on board with children, right? So it doesn't matter what political side of the fence you're on. People love kids, and we all want to do what's best for our next generation. And so though I shouldn't say it was completely unexpected, I think some of the outlying funding streams and relationships that continue to go on to this day were unexpected. I could have never anticipated the relationships that were built. I can call up Dr. Mary Applegate, who from the medical director of our Ohio Medicaid. And, I had lunch with her on the patio out here, just her and I, and she said, she was talking about the challenges of funding streams, and I was talking about the challenges of our rural community. Benton County has 16,000 people in the entire county, and one stoplight, literally one stoplight, one gas station in the entire county. Meigs County hasn't, or for many, many years, had no hospital. So I was able to have those one-on-one relationships with state policymakers about the specific needs of rural communities such as Appalachian Ohio. That was very unexpected and delightful.
So thank you. So, could you give us an example of how you then, work through this coordinated systems, work together to help a family or a young child? What were some of these experiences that really stand out for you?
Sure. That's an easy one. I've got a couple of them that come to mind, but so one of our coordinated systems of care through Launch is called the Family Navigator Care Coordination Program. So, and I have an amazing colleague named Sue Meeks, and Sue Meeks is a nurse by training, and she started the Family Navigator Care Coordination Program several years ago and works with what we call the Interdisciplinary Assessment Team. So it's a group of healthcare professionals that work here in Athens that's comprised of a pediatrician, a developmental pediatrician that comes down from Nationwide Children's Hospital, a pediatric psychologist, a speech pathologist, an audiologist, a social worker, a nurse practitioner, a registered nurse. It's just like a mini all-star baseball team. And essentially what they do is they treat our kids as like a one-stop shop. Well, Sue Meeks, who heads the Family Navigator program, was called out down to one of our rural Benton County families because of a concern about a little guy who was having problems with mobility issues. So she goes to the home, which is in the middle of nowhere in Benton County. The family had just moved from a surrounding county, and the mother had some mental health issues. The father had some physical health issues. Mom was pregnant with her second child, and the little guy in question was getting ready to start to enter school, but there were some concerns about a possible developmental delay. So Sue goes down there, literally goes and gets permission, of course, goes in the house and realizes that the family's having some challenges. They were doing the best they can, a young family, like many, many of our families all across the nation. Little guy was not able to walk because of some disabilities. Family didn't have the resources to get a wheelchair or to get him enrolled in school because the school needed a birth certificate. Well, the family had recently moved, and the birth certificate was not to be found. So my very dedicated colleague, Sue Meeks, drove to the health department in Hocking County, where the family lived, and they said, well, you can only get a birth certificate with cash. Well, the family didn't have the resources to give much cash over. So Sue came back down, like just many of we have dedicated colleagues. Sue comes back to where we work. We work together in Athens County. She literally walks down the hallway and puts her head into the door of her colleagues and say, give me $5, give me $5, give me $5, give me $5. I'll explain later. Give me $5. So she gets $25. She goes to the health department. Of course, this is on a Friday afternoon, right? And the deadline is Monday, like Murphy's Law. So she goes down. She goes up to the other county. She buys the birth certificate. She goes back to the Vinton County to get the kiddo enrolled in school. The kiddo needed a wheelchair because he had some medical issues and needed a wheelchair to be mobile within the public school setting. She calls somebody else who is able to get a wheelchair donated. In the meantime, she calls Community Mental Health Center to get mom some help because mom was having some mental health difficulties and was about to give birth. In the meantime, she calls the local HUD housing authority and gets the family signed up with housing to get them in a less rural setting so that they were less isolated in the community. And because they had transportation issues, she wanted them to be able to at least be within walking distance of the school system and the library and that sort of thing. Long story long, fast forward 6 months, and the family was in new and safe housing. Mom was getting treatment for her maternal depression. She was touching the baby. She was holding the baby. The dad was on the mend in terms of his physical health issues, and the young boy was enrolled in school. So there's an example of going across 4 different county lines to get a child, not only the little kiddo who needed services, but his family needed services. And because of my one amazing colleague, she was able to change this family's life because of the coordination of systems of care. That without IPAC, and I wouldn't say Launch can completely take credit for this because it was IPAC and it was Sue individual. But without Sue knowing those colleagues, it could have been months before the family needed these coordinated services, or could get the coordinated services that they needed. So, there's a feel-good hallmark story of how this stuff works.
Right. Yeah, on the ground, having the impact, So which then leads me to the, because I have about 2 more questions for you, right? So, but the first one, the other question I want to ask you is that what words of advice would you give to other colleagues working in rural healthcare settings? I mean, you just told us this story of the impact of just, one kind person on a Friday afternoon, that made all the difference in the life of one family. So, what else would you tell your colleagues about, working in rural healthcare settings and what it takes?
Sure. So, again, going back to the piles I've stepped in that I don't want other people to step in. One of the things that I truly underestimated was just the amount of time that it takes that completely pays off in terms of traveling around and developing relationships and telling those stories. So, I can go to all the state policy meetings in the world at the Department of Health, the Department of Mental Health and Addiction Services, the Department of Developmental Disabilities, all the departments of. And I can sit around those tables, but unless I'm engaging the policymakers on stories such as what Sue did, nothing gets anywhere. Like, people have to feel like what they're doing makes a difference. And there were many times, and I went through many bottles of aspirin, Dr. Francis, I have to tell you, it was not easy. Nobody ever told, I'm a counselor. Nobody ever told me about this policy stuff. A lot of it was learning along the way, but I underestimated just how far those relationships go. That really, the advice that I would give is to not give up, because change is going to happen. And there are things that you think are going to happen quickly that takes years. And there are other things that I had never anticipated. I never anticipated what funding streams became available to the launch colleagues as a result of sitting around the tables together. And you can't sit around those meetings together if you don't make the time, where you say, oh, I'm too busy, I'll call in. Though, there's nothing that takes the place of face-to-face relationships and telling the stories about the kids that we serve, because even in the lands of bureaucracy, people get around the table for kids. The other thing I have to say that in terms of advice is really investing in the community. So, I'm very proud of the work that we did in terms of workforce development in terms of Southeastern Ohio. You can't downplay evidence-based practice. You can't downplay the importance of educating. What we say is everybody that touches the life of a young child. Okay, so IPAC, Integrating Professionals of Appalachian Children, was our mother agency. But really, training the bus drivers, training the cafeteria workers, getting people, train the trainers in this area so that there's a sustainable workforce that's continuing to be motivated and on the cutting edge of research. Because oftentimes what was frustrating was that oftentimes I would go to Columbus and they'd say, oh, those poor people of Appalachia. And while I say that, my hand goes down like they're patting my head. And it would frustrate me because I would say, what do you mean those poor people of Appalachia? These are the most resilient people you've ever met in your entire life. And at the university, I am proud and honored to be working with amazingly brilliant people who have great vision and great missions in terms of trying to make our life better, as many of my rural colleagues do across the United States. It doesn't matter where you are. So, really investing in a sustainable workforce so that your community knows that you're not just doing lip service. Like you show up to the Benton County school system with backpacks to help to make sure that our kids are fed. Of course, launch can't buy food, but that you come to the table and you put in your time and develop those relationships, and they pay off. I swear, they pay off. The other advice is that if there's a language with colleagues that you don't know, you need to learn it. Dr. Bill Custer out of Georgia State University taught me what a return on investment study was. Through the Family Navigator program in interdisciplinary assessment team, we did a report on a return of investment of how prevention works. And what he found with our colleagues at the Voinovich School and with Family Navigator was that for the most conservative estimates was that for every dollar we invested in young child health, we got a $4 societal return on investment later.
Wow.
So isn't that crazy?
Yeah.
So we, as social service touchy-feely people, I always knew that prevention worked, and I tell Dr. Oppenheim this all the time, we know prevention works, but when we were able to have a health economist put our language as social service providers into dollar terms, that's a language that I never knew that really has gone far. The least conservative estimate, Dr. Francis, was really amazing, was that for every dollar we invested in young child wellness, we got an $8 return on investment. $8 in return. Wow. Because of prevention. So as Samsa says, prevention works. And now, because of launch, we were able to hire a guy to teach us that language about financing and reimbursement strategies so that we can help get these discussions going to really smooth out these kinks, particularly in the age of the Affordable Health Care Act, getting people signed up for services so that they can get their health care for their children. So, learning the languages that that you're not comfortable with, I think was also an advice, and I'll shut up there.
Well, thank you for sharing that, and finally, Dr. Graham, I know you mentioned, your workforce development and, you're a bit there, the activities and tasks around really working to sustain the workforce in your rural community as one of those, moments that you are most proud of. But are there any others that you'd like to share with us? Because it sounds like there was a lot going on in Ohio and still is.
Yes, ma'am, there is. I'm very proud of the collaborations that have taken place through Project Launch, through IPAC, and through Project Launch. We were able to get a regional transportation committee going through some Project Launch seed money that has gone on after us. Integrating Professionals for Appalachian Children continues to bring hundreds of thousands of dollars into this community in terms of working on trauma-informed care in our local community with Dr. Hannah Lambert. We had over 550 individual trainings for workforce development as one of the strategies for launch. Through our developmental assessments and screenings, we had over 14,000 developmental screenings and assessments done for young children, including ages and stages social emotional questionnaire, ages and stages questionnaire, and maternal depression screening. We were able to educate providers on how to get reimbursement for that sort of thing. We were able to implement some of that in our local health department so that our families and children whose only medical care comes through a health department can still get screening and services. One of my babies was behavioral health and primary care integration. Our local federally qualified health care center and one of our local community mental health centers merged to be a dual umbrella for our underserved population. My background's in mental health. Folks with severe mental illness die on average 25 years sooner than most people. So the sooner we can get to these kiddos that might be suspected of delays, either mental or cognitive, the sooner we can get them services they need. We were able to co-locate providers into local pediatric offices. We were able to work with the Ohio University Psychology Department to put in trainees at the local OBGYN clinic to do Edinburgh depression screenings, because a lot of the gaps in services were children and women and families who would never in a million years be seen at a community mental health center, but it's no stigma if they go to their pediatrician. So we really worked hard. I'm proud of my colleagues, man. I'm proud of how dedicated. Sorry, this is a Hallmark moment. Play the violins here. I'm super proud of my colleagues and how welcoming they were to me in the community as an outsider, and just having the privilege to meet so many dedicated folks who really make huge, huge impacts in this difficult rural setting. The relationship between our state and local councils could not be underemphasized. My partner in crime, Harvey Doremus, who's since retired, and by retirement I mean he just started taking a psychology class at the local university after his ripe old age of retirement. He helped me navigate the language up in Columbus, and likewise I hope that I helped him navigate the system down here. Harvey, don't wear your suit down to Meigs County.
Right.
They won't trust you then. So, like teaching each other in that mutual understanding and the mutual respect of, they do what they do for a reason, we do what we do for a reason, and trying to keep those lines of communication open. I'm proud of Launch. I'm proud of my colleagues. I'm proud of the fact that we were able to call each other and take advantage of the knowledge and not have to reinvent the wheel, take other people's ideas. They were so, like our colleagues in New Mexico with their media campaign, they said, yeah, here, take it. So, just spreading the love and the knowledge so that we just continue to get better. So I would say that's a good question, Dr. Francis. I'd say that's what I'm most proud of.
Oh, great. Thank you so much. Just wonderful work. It sounds like, with all of the practical strategies that you've implemented in Ohio and, focus around the integration of primary care and behavioral health and, work you've done around engaging families and young children, addressing the financing challenges and, really working towards, formulating those state and community partnerships. And, I'm amazed at the return on investment with some of this work here. I know that this does serve as a model for many of us on the phone this afternoon to think about, how do we focus our work around child development in rural communities. So thank you for taking the time to share those wonderful stories with us this afternoon. And before I close up, I just wanted to open the webinar to participants to see if there are any questions for Dr. Graham or for Ekaterina at this point. And so again, if you have a question, if you can just press *1 and that will unmute your phone.
We do have questions from the phone line. Ashley Huddleston, your line is open.
Great. Thanks so much. Can you hear me?
Certainly.
Yes. Okay, perfect. One of the things that I am coming upon in the rural areas or this sort of shortage of trained professionals, developmental evaluators and things, and there's this sort of attitude in some rural areas about screening, which is one of our big strategies in launch, that what's the point of screening? We don't have enough professionals to kind of do something with an ASQ, even if the child flagged. And so that's one of the barriers that we're looking at, and I'm trying to think, we're trying to think through the professional development piece and how professionals can get drawn toward communities to serve them. I'm wondering if you came across that in your project and maybe some ways in which some creative ways in which you did that. We're thinking kind of maybe mobile teams. It sounded like maybe something was going on in the way of that in Ohio. There's also this other piece of kind of training paraprofessionals across systems in general, child development, that there's also this when a child is really delayed and there's not professionals, what to do. So I'm wondering if you ran into that and if you had any strategies for that.
Sure. Hi, Ashley. Yeah, I feel your pain. Yes, absolutely. So, I'm a counselor, so I see things from a developmental perspective. We had providers that literally would say, I don't need to do the screening, I do my own screening. And then you say, yes, doctor, sir. However, let's talk about the importance of why you'd screen. And so you asked a couple questions in there, so let me give it a shot, and then I'll swing it back to you to make sure that I'm answering or addressing some of the questions that you had. So in terms of getting people on board, what I found over time after many, many headaches was that if I could get a couple of key champions, particularly physician providers or family nurse practitioners, because as I'm sure you face, we don't have a lot of providers running around, is that if you can get a couple of providers, particularly physician and nurse practitioner providers, on board, sometimes that will be a way to get a physician's ear in terms of the importance. As a psychologist or a psychology-trained person, there's a couple of us, there's a bunch of us around here, but frankly, we're not doing a lot of direct service for multiple reasons. But, there's the health shortage professional areas. There's a lot of federal programs that if you're near a university, you might be able to get a pipeline into some of the students that could be trained. We utilized our doctoral students at the psych program to do training in the OBGYN clinic, so they could do some of the maternal depression screenings where if you ran into a practice that said, oh, we don't have time, our nurses don't have time, it's not in our EHR system, sometimes by providing students, the students can do that work and show kind of practice model for the practice how easy it is to do. One of the strategies that I use that, if I had 5 more years, I continue to do this, would be literally going from practice to practice and teaching how to bill for those screenings. For the providers that talk dollar signs, the 96110 codes for a 12-minute screening, for 10-minute Edinburgh depression screening in the state of Ohio, they can get $12. So you multiply that by a larger practice in a hospital setting, and they might find it lucrative. So, I don't typically think that way, but that was kind of a way to get into, maybe screenings are important because the American Academy of Pediatrics says that it is. And, by the way, I can do a 96110 billing code and get reimbursed for that, which makes it worth their time. The other thing that I think you mentioned, Ashley, was in terms of developing teams. I oftentimes, it was a huge investment, but our folks from our Duke, Cincinnati Children's Hospital, our folks from Nationwide, Sometimes if my cries to implement developmental screenings and assessments fell on deaf ears, we would bring in the big guns from Cincinnati and Columbus to do evidence-based trainings to teach the surrounding staff why it's important to do quality evidence-based treatment, why it's important to do things to fidelity, so that we kind of taught around the docs, we taught around the family nurse practitioners, so that we tried to implement it as a culture, so that word of mouth would say, oh my gosh, as an example. And then, again, I guess this is a last train of thought, would be just telling the stories of, you know what, this age is a stage of social emotional questionnaire. It literally takes 5 minutes, but look at what happened in telling the success story. So I don't think it completely solves your problem, Ashley, but those are some of the things. I mean, we tried several different ways of going behind the scenes, but teaching the reimbursement codes, training in teams, and really trying to, you know, go for screenings and assessments that could be widely utilized and distributed by, you know, maybe some of your LPNs or some of, you know, your front desk staff to help make that workload easier in those busy practices. Mm-hmm. Does that help?
Yes, and I feel fairly confident about getting the screenings done, but what there's a real lack of is physical therapists, speech therapists, those professionals, and in a way, you know, and we can't make them appear, you know, that a lot of times they're just not in the rural communities, those very specifically trained people. And so maybe you're looking at sort of preventive strategies like making sure that child care providers, through our access and relationships with them, are really doing a lot of activities focused on fine motor and speech. And so there's that preventative piece, but for the kids that are really struggling, if you ID a real problem through a screener, and that there isn't a speech therapist, or the waiting list is 6 months long for a child to even see one of those specific developmental professionals.
So actually, what community are you from?
We're with the Arkansas launch, so Mississippi County area. And so that's one of the things as I ask people about screenings, they mention, well, we do the screening, but then it's a very long wait for a speech therapist to kind of follow up. And so in thinking creatively, I just wondered if people are there incentives programs that some of these schools may have done through launch projects to get them into high needs areas, and just sort of looking at those things. And I didn't know if you had experienced that. Just, wow, there's not a speech therapist in this area really. And so, or then maybe looking at strategies like, could we draw someone like a mobile team to come here and do speech, you know, from a more urban area? Just, I'm thinking through strategies with that, because I know there's frustration on that end. So what's the point of an ASQ if we have no developmental specialist? Yeah, exactly. Exactly.
Right. So one of the things, so there's a couple of things I thought of while you were talking. There's the federal programs like the National Health Repayment Plan and the National Health Service Corps that helps get new practitioners early in the pipeline. Another thing you might want to check out is the laws in Arkansas. My state colleague and I were part of the Health Policy Institute of Ohio that was really on the cutting edge of doing telehealth work. So you may want to check into Arkansas's laws about, connecting in. They did a pediatric psychiatry network in one of our rural clinics that was outside the launch guidelines, did a pilot project through the Ohio Department of Mental Health and Addiction Services where they piped in a psychiatrist from Columbus once every, Tuesday morning into New Lexington, Ohio. Because I'm sure, as you probably have also, psychiatry is so hard to find down here.
Yes.
And so the pediatric, if you look up Ohio Department of Mental Health and Addiction Services PPN network, or the Pediatric Psychiatry Network, I've got a colleague, Beth Ferguson, up there who's a nurse by training in the Health Policy Institute of Ohio. But you might want to look at or ask at your state council what the telehealth bills are in Arkansas, because you might be able to pipe somebody in You know, obviously in speech and that sort of thing, I don't know about speech, but that might be an avenue to look.
So I just like to ask if there's anyone that, you know, another question for, you know, Dr. Graham.
This is Joyce with SAMHSA.
Oh,
I just wanted to chime in and add another piece to that. I think on the telehealth side, we've learned that there are some really interesting models. I haven't heard them adapted to speech or OT types or PT types of situations, but there have been some interesting applications where you might be able to do that kind of pulling somebody in through technology, but also teaching some of your families and early childhood settings how to, as you were starting to talk about, to do some of these types of techniques in natural settings. So just another consideration. And I'd like to hear more about that because the associations might be interested in that as well.
So thanks for sharing that, Joyce. Now I'm looking and I'm a little sensitive to time here because we're almost at the end, and just want to take a few minutes to, you know, just talk a bit about some of the upcoming webinars over the next couple of months. But before we end, you know, I have to say again, thank you so much to our presenters this afternoon. It was indeed a pleasure to talk with you, you know, about the work that you're doing and, you know, about this focus around early child development. And to all of you who joined us on the webinar this afternoon, again, I say thank you for participating. And I'd really like to take this opportunity to share some information with you about upcoming webinars in our 2015 Rural Behavioral Health Webinar Series. So the second webinar focused on trauma-informed schools in rural communities, you know, promoting resilience in children and youth, will take place on June 24th, 2015 from 3 to 4:30 p.m. Eastern Time. And then the third webinar, entitled Crisis Intervention Planning, a look at innovations, will take place on August 26th. From 3 p.m. to 4:30 p.m. Eastern. So please mark your calendars to join us for the upcoming webinars. We will also forward additional information about the registration for these webinars in a few days and over the next couple of weeks. And so now, before you leave the webinar today, though, we're going to ask if you just please take a few minutes to complete the feedback form using the link that is listed on your screen here. You know, we value your feedback and use the information that we gather from this feedback form to inform subsequent webinars. So please take a few minutes to provide us with your feedback. And again, have a good afternoon, everyone. And once again, thank you so much for joining us.
That concludes today's conference. Thank you for participating. You may disconnect at this time.